Hello everyone, in this video we will be seeing how to give stretching of upper limb. To increase flexion of shoulder, stretch the shoulder extensors. This is the patient's and therapist position for Teres major stretching. Patient position is supine, therapist position, hand placement and procedure. Grasp the posterior aspect of the distal humerus just above the elbow. Stabilize the axillary border of the scapula to stretch the teres major, or stabilize the lateral aspect of the thorax and superior aspect of the pelvis to stretch the latissimus dorsi. Move the patient's arm into full shoulder flexion to elongate the shoulder extensors. Shoulder hyperextension. To increase hyperextension of shoulder, stretch the shoulder flexors. Patient position prone, therapist position, hand placement and procedure. Support the forearm and grasp the distal humerus. Stabilize the posterior aspect of the scapula to prevent the substitute motion. Move the patient's arm into full hyperextension of the shoulder to elongate the shoulder flexors. Shoulder abduction. To increase abduction of shoulder, stretch shoulder adductors. Patient position supine, therapist position, hand placement and procedure. With the elbow flexion to 90 degree, grasp the distal humerus. Stabilize the axillary border of the scapula. Move the patient into full shoulder abduction to lengthen the adductors of the shoulder. Shoulder external rotation. To stretch the shoulder external rotation of the shoulder, stretch internal rotators. Patient position supine, therapist position, hand placement and procedure. Abduct the shoulder to the comfortable position, initially 30 to 45 degree and later 90 degree. If the glenohumeral joint is stable, or place the arm at the patient's side. Flex the elbow to 90 degree. Grasp the volar surface of the mid forearm with one hand. Stabilization of the scapula is provided by the table on which the patient is lying. Externally rotate the patient's shoulder by moving the patient forearm closer to the table. Then fully lengthen the internal rotators. Shoulder internal rotation. To increase the internal rotation of the shoulder, stretch the external rotators. Patient position supine, therapist position, hand placement and procedure. Abduct the shoulder to a comfortable position to allow the internal rotation to occur. Flex the elbow to 90 degree. Grasp the distal surface of the mid forearm with one hand. Stabilize the anterior aspect of the shoulder and support the elbow with your forearm and hand. Move the patient arm into internal rotation to lengthen the external rotation of the shoulder. Shoulder horizontal abduction. To increase horizontal abduction of shoulder, stretch pectoralis muscle. Patient position. To reach full horizontal abduction in supine position, the patient shoulder must be at the edge of the table. Begin with the shoulder in 60 to 90 degree of abduction. The patient elbow must be flexed. Therapist position, hand placement and procedure. Grasp the anterior aspect of the distal humerus. Stabilize the anterior aspect of the shoulder. Move the patient arm below the edge of the table into full horizontal abduction to stretch the horizontal adductors. Elbow flexion. To increase elbow flexion, stretch the long head of the triceps. Patient position, sitting or lying in supine. Therapist position, hand placement and procedure. With the patient sitting or lying supine with arm at the edge of the table, flex the patient's shoulder as far as possible. Flex the elbow, grasp the distal forearm and stretch the long head of triceps. Elbow extension. To increase elbow extension, stretch the elbow flexion. Patient position supine, therapist position, hand placement and procedure. Grasp the distal forearm. Stabilize the scapula and anterior aspect of the proximal humerus. Extend the elbow to lengthen the elbow flexors. To increase elbow extension with shoulder extended, stretch the long head of the biceps. Patient position supine, close to the side of the table. Therapist position standing. Stabilize the anterior aspect of the shoulder, or with patient lying in prone, stabilize the scapula. Pronate the forearm, extend the elbow and then extend the shoulder. Forearm supination or pronation. To increase supination and pronation of the forearm, hand placement and procedure. With the patient humerus supported on the table and the elbow flexed to 90 degree, grasp the distal forearm, stabilize the humerus, supinate or pronate the forearm just beyond the point of tissue resistance. Be sure that the stretch force is applied to the radius rotating around the ulna. Do not twist the hand. Repeat the procedure with elbow extended. Wrist flexion. To increase the wrist flexion, stretch the wrist extensors. Patient position sitting, therapist position, hand placement and procedure. The forearm may be supinated in mid position or pronated. Stabilize the forearm against the table and grasp the dorsal aspect of the patient hand. To elongate the wrist extensor, flex the patient wrist and allow the fingers to extend passively. To further elongate the wrist extensors, extend the patient's elbow. Wrist extension. To increase the wrist extension, stretch the wrist flexors. Patient position sitting, therapist position, hand placement and procedure. Pronate the forearm or place it in mid position and grasp the patient at the palmar aspect of the hand. Stabilize the forearm against the table. To lengthen the wrist flexors, extend the patient's wrist, allowing the fingers to flex passively. Radial deviation. To increase radial deviation, patient position sitting, therapist position, hand placement and procedure. Grasp the ulnar aspect of the hand along the fifth metacarpal. Hold the wrist in mid position, stabilize the forearm. Radially deviate the wrist to lengthen the ulnar deviation of the wrist. Ulnar deviation. To increase ulnar deviation, patient position sitting, therapist position, hand placement and procedure. Grasp the radial aspect of the hand along the second metacarpal knot on the thumb. Stabilize the forearm. Ulnar deviate the wrist to lengthen the radial deviators. CMC joint of the thumb. To increase flexion, extension, abduction, adduction of the CMC joint of the thumb. Patient position sitting, therapist position, hand placement and procedure. Stabilize the trapezium with your thumb and index finger. Grasp the first metacarpal with your other thumb and index finger. Move the first metacarpal in desired direction to increase CMC flexion, extension, abduction or adduction. MCP joint. To increase flexion, extension, abduction or adduction of MCP joint. Patient position sitting, therapist position, hand placement and procedure. Stabilize the metacarpal with your thumb and index finger. Grasp the proximal phalanx with your other thumb and index finger. Keep the wrist in mid position. Move the MCP joint in desired direction for stretching. Allow the IP joint to flex or extend passively. PIP and DIP joint. To increase flexion or extension of proximal and distal PIP and DIP joint. Patient position sitting, therapist position, hand placement and procedure. Grasp the middle or distal phalanx with your thumb and finger. Stabilize the proximal or middle phalanx with your other thumb and finger. Move the PIP or DIP joint in desired direction for stretch.